Welcome to Archways Threads, a show focusing on the threads of family and recovery support services that help make up the tapestry of life in recovery. Join us as we share stories from peers and participants in the field and practice of peer recovery support and family support and strengthening. And now, your host, Archways CEO, Michelle Lennon.
Welcome, everybody. My name is Michelle Lennon, and I am with Archways and the host of our Archways Threads podcast. And today I am here with Carina Raya, who is this amazing student at George Washington University and heading to med school and doing a lot of work around public health, and has recently been in New Hampshire studying the capacity for probably acceptance, right, of the idea of having an overdose prevention site in the state, and we're super excited to have her. Right now in New Hampshire, as is going on with like the rest of the country, many of us are kind of reeling with the impacts of some of the clawbacks of funding that have occurred, and not identifying as, Republican or a Democrat myself. I mean, as an independent, I'm just seeing the impacts. And that's been, somewhat catastrophic for the peer recovery field, public health, a lot of different programs, in our state and of course nationally too, as we've been talking to our friends in other systems and other states. And one of the things that happens when things like this occur is we begin to kind of mobilize to provide some advocacy so people can really get some good education about what's really going on when it comes to the boots on the ground and what we're seeing in our state. And I know for us as a recovery center, family resource center, we had one of our senators stop by last Friday, actually.
Which one?
Senator Matthew Hassan.
Nice.
Yeah, and just kind of talking about, what does it look like boots on the ground? And for us, our healthcare disparities grant was, shut off overnight, and they were asking, what does that mean for you? And, thankfully, like we're an agency that has multiple sources of funding, and I was able to, talk to some of our funders and, quickly try to plug holes. But, whenever you're plugging holes, you're taking money from other places when we run into situations like this. And when we're providing advocacy, one of the things that often happens is we're asked to provide stories, about the impacts that different programs have, because ultimately these funding cuts are tied to programs and they're tied to people and jobs, but the participants that, access the programs. And we were in a meeting together and you had shared that you've been pretty adept at sharing your story and that it was a process to get there. And because one of the concerns I always have is somebody that runs an agency and we have like 4 centers and we have coaches and family support specialists that are supporting people, is we don't want to objectify our staff, our people, the people that have stories to tell, because really they're accessing support sometimes when they're at the most vulnerable point in their lives, and to kind of hold them up as some kind of project, or something just seems so contrary to like our core values, but at the same time, we know that if we don't get those stories out, people do not realize like the impact that the work that we do in the peer recovery support world really has, or in family support for that matter. So, I talked to Carina about, her experiences with sharing her story, because she had volunteered to kind of talk about that with all the center directors actually in the state of New Hampshire. And she's got one heck of a story and laundry list of credentials. And so while I know some of them, I just asked her kind of to, what she would be comfortable sharing to share with all of us. So
Cool. So my name is Carina Raya. The first credential that I have that is no less valuable than any of the others is I'm a Bikram yoga teacher, and I have been a Bikram yoga teacher since 2014. Why that's important will come up in a minute. In May of 2024, I graduated from the University of New England with a degree in medical biology and biochemistry. I completed my degree in 3 years. I graduated summa cum laude in the top 10% of my class at 33 years old. I'm currently a master's in public health student at the George Washington University, and I'm an accepted student for the class of 2029, meaning I'll graduate in 2029 from Marshall University's Jones V. Edwards School of Medicine. And why I feel like I need to give this whole laundry list of credentials is like you're talking about. We are living in a time where the administration, for whatever reason, wants to cut down on the amount of public safety net programs. And that's really devastating for people who use them. And it would be devastating even for me today, a person who has like 15 years of recovery in the bank. So my story kind of starts, when I was 18. So coming from a sort of difficult childhood background, when I left my family, I started using drugs, chaotically, using alcohol and other substances. And it was sort of a way for me to like forge my own identity.
Mhm.
But really, there was a lot of trauma built up there. And I ended up spending a lot of time in the mental health system, which, shout out to the mental health system. It's not perfect, but dang, I spent a lot of time in the state hospital, and I'm so glad that it was open. And I'm so glad that there were staff there that were friendly and caring and wonderful. And Donna, if you're out there, I've been looking for you. You were always so nice to me. And I've always been trying to find somebody that knows you to be like, you really made a difference in my life. But anyways, yeah, spending so much time in the mental health system. So kind of right off the bat as an adult, ended up on Social Security disability.
Mhm.
Not common for a young person. Looking back, I'm like, wow, I don't even know how that happened. But I have been able to not just survive, even though for years it did just help me survive. But in more recent times, I've been able to thrive as a person because of that program, and not just, the access to a monthly, payment, but it opened up the doors for me to receive Medicare, which is an amazing insurance, and when I used to have Medicaid as well, it was easier to get on Medicaid if you were disabled and had Medicare.
Mm.
So having full coverage for all of my physical and mental health needs was essential, for my survival for so many years. And then as I made it through, sort of that time of chaotic drug use and like mental health struggles, when I came to the end of it, being on Social Security gave me access to this other program called Vocational Rehabilitation.
Mm.
I don't know if you've ever heard of it or you know anyone who participates with them.
Voc rehab, yes.
They're amazing. Yeah. Shout out to all my Voc rehab people over the years. So in 2013, that's when I really, got into recovery, and I wanted to be able to go back to school or get some kind of job training because for the first time in my life, I felt like I could.
Mm.
All those public safety net programs, they fed me, they heated my apartment, they gave me enough money to ride the bus to the methadone. Like they kept me alive for so many years. But then I was like, oh, I could probably do more than just live. And in 2013, Vogue Rehab paid for me to go to yoga teacher training, which really changed my life in more ways than, I could even talk about on a podcast. And I'm so lucky to have done that. It gave me a doorway into being able to work overseas, learn different languages, get really interested in public health, and, eventually the sort of motivation to want to broaden my scope of practice. But what else happened with that, in terms of my story is when I was a new yoga teacher, the studio owner that I was working for, she had experienced, drug use in her family as well. Somebody close to her had experienced chaotic drug use. And when I came in, I was like, yeah, I'm on methadone clinic. I'm struggling, but this yoga really helps me. My studio owner got interested in that. And at first I thought it was, and it may have been, sure, a genuine interest in me and wanting to help me and maybe wanting to help other people. So I was interviewed by her and was eventually, my story was put on in TED Talk, which later on I had absolutely no control over. And when I had a falling out with this person, she wouldn't take it down, and all this information and pictures about me are out there into the world that I, have asked her to take it down multiple times. Can't. So anyways, and then she got in touch with the Portland Apparel. I was interviewed. There's a front page paper article about me, which I think was good. It was during a part of the opioid epidemic where there were not a whole lot of survivor voices at that time. And I feel like the writer of the article did give a fair and balanced, description and provided a lot of like my own quotes and stuff. So I appreciated that. But then I was sort of roped into this recovery yoga program where I was kind of like held up as this, person in recovery. And like all I did was yoga and now I'm cured, which wasn't true. Before I came to yoga, I went to go see a psychiatrist after stopping all mental health care for a couple years. Just by coincidence, I saw this doctor, Trisha Mendoza. If you're out there, you're great. And she looked at me after I told her my story and she goes, I think you deserve a chance. And nobody had ever told me that before.
Yeah.
And she prescribed me a medication for narcolepsy because I didn't know that there was some like disordered sleeping issues that I was having. But long story short, this medication put me to sleep at night. So during the day, I didn't sleep 20 hours a day. I was awake. And that's why I went to yoga, was because I had the time and the energy to do that. I was already in recovery when I went to yoga. So it felt so disingenuous to say that, yoga is the key to recovery. It's great. It's helpful. It does amazing things. But recovery in general is not one thing.
Right.
It is a wide collection of all the things in your life that change.
Yeah.
And at first, maybe it's one thing, but then it's another thing and another thing and another thing. And you realize all the things around you are suddenly not the same familiar things that they were for years while you were, engaged in chaotic drug use.
Yeah.
You're in a whole new room. You've opened the door. You walked into a room that you might not recognize all of it, but it's all the things that you have put around yourself.
Yeah.
And that is your recovery, I guess.
So to talk about it, like in terms of recovery coaching, like we would call that your recovery capital, right? Like you're unpacking past trauma, you're putting things in place that are supporting you. You're meeting, those basic needs in the pyramid of the hierarchy of needs that really is not so pyramidal. It's like, because sometimes I hear people say, well, you can't find recovery if you're experiencing homelessness. Not true in my experience. Might have been tough, but one of the people that my husband and I are still close to, that was like one of the first people we coached. I mean, she's experienced homelessness on and off like her whole adult life, and still has sustained her recovery. She had a couple of reoccurrences of use, but she never stayed there.
Yeah.
So when I think about that, and then also thinking like it's not ever just one thing. How I think that's one of the things that's perpetrated on a lot of people. And it's so dangerous, right? Because if the one thing that you're told is doesn't work, then what?
Then there's nothing.
Yeah.
The only leg you're standing on.
Yeah. And it's funny because today I go to a group coaching session like it's twice a month. And one of the questions that was asked of me was, what would it take for you to be dialed in, to like your next steps or whatever. And just kind of thinking like it's all a process. It is all a process of getting better, and for me, like right now, a big focus is just nutrition, like, and what does that mean? Well, I'm a lot better today than I was a year ago about what I am putting in my body as fuel, thinking about nutrition and recovery.
Yeah. Huge deal. I worked at a farm when I first got into recovery, which helped me pay to get to my yoga training. but it's like I had access to like fresh fruits and vegetables, like farm raised meats, like high quality dairy products for like also the first time in my life. And it made such a big difference. It really was the perfect storm. There was great physical exercise. There was a community of people who cared and asked about how I was doing.
Healthy social network. It's part of what supports recovery, right?
Yeah. And part of, the reason why some people end up using drugs to begin with. I mean, for myself, I never had a robust support system. So, when I was about to graduate high school, I was like, oh no, what am I going to do? I'm losing everything that I have. And I found, a family in people who use drugs.
Yeah. So, yeah. And sometimes it's
hard
better
to
than
let
what you
go.
have. Yeah. Yeah. And, thinking about that, we in our practice never presume to tell people you have to cut people who use drugs out of your life. Sometimes you have to have safety plans around them, or know what your own temptation limits are, as far as that goes. But I think that's another thing. Like, we hear those absolutes too often. Like, you can't be around those people or whatever. If they're the social network that once saved your life, like, the idea of cutting them out can be like, no way, and it can cause people not to seek what's next. And hearing how you've kind of experienced like one resource after another, and sometimes concurrently, and sometimes like in order, just thinking like how important it is to address it all, but it doesn't have to be all at once. And I think sometimes people think that,
Yeah.
Yeah.
And you think, like when I was first in recovery and teaching yoga, I also had the impression that that was sort of the be all and end all. So another reason why I mentioned this list of credentials that I have is when I was teaching yoga, when I was in my early 20s, I thought that was it. I didn't know anyone who was a doctor or a lawyer who also was like out of the injection drug use closet. So I didn't have sort of the long range objectives that I hope my story can give other people. So from 2014 until, 2020, 2021-ish, I taught yoga and I lived overseas. And then I thought that's, what I was going to continue to do forever. It wasn't until the pandemic happened that I was like, uh-oh, I can't teach yoga anymore. All the studios closed. Like, what is my contingency plan? And, my cousin was like, oh, well, why don't you go back to school? You could go be a doctor. And I was like, what are you talking about? That sounds crazy. But because I love a challenge and I love to do crazy things, I was like, yeah, totally. So I applied to college and I got in. And, I don't want to come across as like, not humble or something, but like I'm a smart person. And why that matters is because I thought that I could be the smartest person in the room and that it would make a difference. Because I'm vocal about having been an injection drug user, having experienced chaotic drug use, like that's part of my story that I value. And I value all the lessons I've learned and the tools I've got from being in recovery. Those are all really important things. So I'm not ever going to not tell my story. I'm not going to be quiet about it. And I realized, as like a 30-year-old college freshman, that apparently not everyone thinks that way. Not everyone thinks that, people who once used heroin can also be doctors. I don't know why, because doctors have higher rates of substance use and suicide than the average population. Fun fact.
But this is what we do, right? Don't tell.
Don't tell anyone.
Don't tell.
Don't tell anyone. So coincidentally, around the time that I applied for college, I was contacted by a friend of mine who was a peer support worker in Claremont. And he was like, oh, there's this lived experience advisory panel that is like getting together. The New Hampshire Foundation for Healthy Communities is putting it together. And they're basically going to provide like education to various entities throughout the state to try to improve healthcare for people who use drugs. And I was like, oh, that sounds fun. And I started telling my story And I realized, though, for the first time, that I could tell my story with my own voice and with autonomy and with like a long range objective. And I think that's kind of the critical difference between when I was, in my early 20s, sharing my story compared to what I do now. So in my early 20s, it was like, oh, you did yoga. Now you're in recovery. Like things are great. But it wasn't like there was no long range objective. And it wasn't like I was.
It's basically to advertise for the studio.
Yeah. And it wasn't even to advertise for the studio. It was to advertise for this person and how like great their idea was, basically.
Yeah.
And when I started working with the foundation, it was like, we're going to have you talk to, the birthing center at Concord Hospital, because these people want to learn how to better treat people who use drugs because they think they're probably not doing it right. People are not having good experiences. There are people who use drugs who like are trying to have their babies, but like it's not working out.
Yeah.
And I was like, let me like think about that for a little bit. So it made me not just have to tell my story, but sort of be introspective about, well, all the times I was in the hospital, how did I feel?
Yeah.
What could have been different? And it sort of was like a problem solving exercise.
Yeah. So being solution focused, like, because ultimately doctors go into that trade usually, if it's not just for the money and job and prestige, because they want to help people, but they're not helping people when they're saying horrible things to people that are walking in the door looking for help. And in my own family's experience, my husband had had experienced an overdose, and my son had provided the Narcan. I wasn't home. I was actually training, and I will never forget it. It was like midnight when I got the call from my son. My husband had overdosed. They had taken him to the local hospital, and I sent a recovery coach on that worked with me to the hospital, who's also very friendly with my husband. And thank God she answered the phone that night. She went with him into the ER. He was already suicidal at that point because his big issue was pain that wasn't being managed, and it's a long story with him. The doctor's not listening for a year, assuming it was something else until they found the problem. Finally, apologized, but apologies only go so high. Yeah. So, but that night, the only thing the doctor said to him was, "Has your wife left you yet?" That was the only thing that he said to him, and the nurse was the one that put her hand over his and said, "Oh, honey, you're such a good," what she did. You're such a good looking young man. You have your whole life ahead of you. I really hope you get this handled. And the recovery coach there just said, yeah, she couldn't believe it. Of course, the doctor didn't know she was a peer support worker. Just assumed, friend showed up in the middle of the night because you were brought into the hospital and you overdosed, and you know, and it wasn't the first time like we had a bad experience there, because he had a little bit of an infection in his arm had gotten, and he left to go get like some scan of his arm or something, and the doctor comes to me and is like, your husband's an addict, right? And I said, oh, dude. Yeah. And so I just looked at him and I said, you mean, do I know that he has a disease of addiction running in his brain because doctors like you prescribed Oxy 80 twice a day for an entire year and then cut him off overnight because he's working comp right now? Yeah, I think I know that. And he's like, oh, you guys have been through a lot. I'm like, you think? So it's stigma is everywhere. And when I think about telling those stories, we've come a long way, but that's again like sharing your story, your experiences with those that really want to make a difference, because this is so much burden, right? I mean, we have a overtaxed healthcare system, an overtaxed mental health system. The money is drying up for services everywhere right now because of this clawback from the feds. And at the same time, like, the needs haven't stopped. They've grown.
They have not stopped.
I thank God our overdose rates have actually gone down in New Hampshire, but people do not realize, like, they're so immune to statistics now But, the DEA agent that spoke at a prevention conference that I was at recently had shared, like, the overdose death rates in the United States right now, it's like 9/11 happening every 2 days, and we barely talk about it, and we're pulling back funding right now, and it's like I said, as an independent, I'm like, we gotta get along to have solutions. And I love, like, what you were saying, like, this is about being solution focused, sharing your story with a purpose, and it's not about pushing an agenda other than to let's make things better for people.
Thank you for listening to Archways Threads. If there is a topic you'd like to see us cover, email us at podcast@archwaysnh.org or call us at 603-960-2128. Visit our website at archwaysnh.org to learn more about the Archways family of recovery and family resource centers.